Well, thanks to everybody for getting here pretty close to being on time so we can have a quorum. And so I will officially call this meeting of the Public Health and Community Committee to order. And I will go down the list. And so first, to be heard today is Representative Hagan, House Bill 657. And if everybody will check the LC, it's LC 520794. Is that correct?
That's correct.
Okay. All right. You've got the floor.
Thank you, Madam Chair.
Okay, I'm sorry.
I do now. Yes, ma'am. Thank you. Thank you, Madam Chair and committee members, for hearing this bill today at the final hour, it feels like. So we all have the correct LC number. I learned something a couple weeks ago when this bill was brought to me, that Georgia has the second greatest number of RCOs, or recovery community organizations, of any in the country besides Texas. That was something I was not aware of. We have a very vibrant one in my area, but I was not aware of how widespread these organizations are. So this bill is intended to create some language in our code that will provide some cohesion and professionalism amongst all of our various RCOs. So what it does is it defines certified peer specialists and the different types of certified peer specialists, and it defines the certified training body that would train them and test them. And of course, DBHDD would be required to certify those people that are in that training body. It also defines what peer support services we would have available to individuals in need of support. And it defines a recovery community organization for substance abuse, or RCO, and some of the basic operation requirements that they would need to have to operate and under the umbrella of DBHDD. And then finally, it says that DBHDD shall designate a statewide recovery community organization to coordinate a network of all the individual RCOs throughout the state. And of course, that would be subject to appropriations as well. So that is the bulk of the bill, and I don't know, Madam Chair, I don't know how much detail you'd like me to go into on that, but
Members of the committee ask you questions?
yes, ma'am.
We got Representative Oliver.
Good morning. Thank you for this bill. I'm aware that Georgia has a very good reputation about this, has been a leader, but I don't know whether or not we are creating new certifications that haven't existed in any way previously.
It is not my understanding that we are. We're just going to make sure that they are operating. Well, Mr. Breedlove here might be able to answer that better than me. Can he come up here and do that?
I just don't want to mess up a good thing.
Right. Well, exactly. And I wouldn't want to either.
Me either.
What's certified now, and what does this add?
If it please the committee. I'm Jeff Breedlove, Personnel and Long-Term Recovery, here for the Georgia Council for Recovery. Representative, we've worked very closely with DBHCD on this bill. This creates nothing new. All those certifications have been done for well over 15 years. Georgia Council is the current statewide RCO. All this bill intends to do is, for the good work of folks in communities, those 45 communities around the state, protect the integrity of their work. It costs nothing to go to an RCO. And we don't want some nefarious actors. We know some folks who come from Florida in treatment, when they escaped Florida, to maybe go to a community and say, oh, we're an RCO. It costs you $1,000, family member, to come here. We're just trying to protect the integrity as we grow, to make sure that should someone try to rip anybody off, that there is some protections that DBHCD can turn to.
And there's no intent of this bill to get Medicaid reimbursement for RCOs.
No, ma'am. You have my word on that. Yes, ma'am.
Thank you.
Thank you. We got Representative Christine.
Thank you, Madam Chair. I love this bill too. I think it's great. So in my community, which is close to Representative Hagan's, or Chair Lady Hagan, this is actually somewhere that people get sent instead of jail time.
Yes, ma'am.
Yes,
Yes, ma'am.
So-
It's the recovery part of that process after treatment.
it
Yes,
is.
ma'am.
Yes.
Yes, ma'am.
So I have been concerned about the credentials of people. You know, I mean, the ones where I live are great. They are wonderful. But just hearing where they are all over the state, I have been concerned about the credentials because they're, as you know, we had another bill not too long ago. They're managing people's lives and helping them get back on track.
Yes, ma'am.
And it's important that they're pointing them in the right direction. So that's the purpose of this bill, is to create a cohesive, no matter where you are, everybody's going to be getting the same training. Am I understanding that right?
It's to make sure, if it please.
Sure.
Yes, ma'am. So we do that, done that for decades. Georgia also has trained more certified peers in addiction and a separate certification for behavioral health done by DBHCD through the Georgia Mental Health Consumer Network than any other state, again, except Texas. We got to do something about Texas with this. We beat them in football, but not this. Go Dogs. But in all seriousness, it's to provide protections that should come on in and present themselves as a certified person, and they're not. Right now, there's nothing in the code where Georgia could do anything about that. Now, this would give the opportunity for DBHCD, the state of Georgia, to go, that's against the law.
Okay. Great bill.
Thank you. And I think one of the things that I think is so exciting about this bill is exact to your point. When you've got a really good, active, vibrant RCO in the community that re-engages people who may have been disconnected from their family and their community and gets them back out there in all aspects of life. This bill would define what that RCO is. It lists out, and some of its basic operation requirements. One of them is that they provide non-clinical services only. So when you're talking about someone who's been receiving some treatment and then they move into that, this wouldn't replace any clinical treatment that they would be undergoing. This is peer support from people who have been there and understand what a person in recovery is going through, and provide that support there that they would need to continue on in their successful journey.
Thank you.
Representative Taylor.
Did you say a number of 45 a while ago?
Yes, sir. There are 45 of these wonderful entities around the state. Yes, sir.
Okay, and so somebody has to apply, and that's what we're trying to do. They apply to become a part of that?
To
or
become
because-
on the team, on the staff, you go through certification to be on the staff. The doors are open to anybody with no barriers to enter to be a part of it as an attendee. There's no barrier to attend
but
whatsoever.
to create a new one?
To create a new one, there's a protocol that DBHCD operates in the state right now. The Georgia Council administers that protocol. Briefly, they are required to have a multiple series of community meetings before they get all the way to the process to call themselves an RCO. So there's multiple buy-in from everybody.
Well, I have a question. I guess I didn't know what RCOs do. Do they are there community meetings,
Well-
organizations, or what? Because I've dealt
Think
with.
of the zone. Think of the zone.
Okay, all
That's
right.
what an RCO does. So,
Okay.
you know, I mean.
I know. Yeah, I
she
know
knows
what the
very
zone
well.
is. I just didn't. I don't think I've
Yes,
ever
ma'am.
heard
Right.
it called an RCO.
Yes, ma'am.
Okay, because I mean, it's fabulous. I mean, there's places for them to come and just hang out and have a cup of coffee, or they have a place to play music and
Yeah,
instruments and
right.
this kind of thing. But they also do they do therapy. So do these places
Oh, yeah,
also
yes,
do therapy?
Right, yes, ma'am. So once you think of it like a baseball field. So there's the foul lines, right? You got to follow some basic things.
Okay.
But inside those foul lines, they're supposed to be different for their community. The one closest to this building is about 2 miles away, called Rise, and it is centered on art and recovery. And then we have them in Gwinnett and in Albany and all over.
Well-
I'm going to stop while I'm ahead on geography.
will this bill, will there be a listing of these people so, for the state, so people would know where they could, where one of us could tell somebody
How to get there.
how to get to them, or?
That's a good question.
They are on our website, on DBHCD's website, and I will work with the General Assembly Working Group on Addiction and Recovery and ask the 4 co-chairs to share with their members what those are.
Okay.
That's great.
Right, okay, and I'm sorry, you will go back to Representative Taylor.
Thank you. I just wanted to make sure which agency they're going to be attached to, behavioral health or community public health? Who are you going to be attached to?
It's going to be under DBHDD.
Okay, that's what it sounds like that's where it should be. I just want to make sure.
Yes, ma'am.
Thank you.
Representative Reese.
Yes, thank you, Madam Chair. Representative, I just want to thank you for bringing this bill. I think this is a good thing. These organizations play a critical role in our community for some people that are at some very sensitive times in their lives. And the last thing we need are bad actors coming in, breaking someone when they just found a little hope. So thank you for this. And at the appropriate time, Madam Chair, I think we...
Thank you, Madam. Thank you, Madam. Sorry. There we go. There we go. Thank you, Madam Chair. Are there any for-profit RCOs?
No,
Okay.
and in this bill, it would not allow a for-profit. They must be not for profit.
How often do we certify these folks?
Every year. They go through a rigorous protocol every year. Then DBHCD recertifies them. So the Office of Addicted Services and DBHCD under Cassandra Price, who reports to Commissioner Tanner.
What's the penalty for someone who promotes himself as being certified but is not, or is a bad actor?
Well, right now there is no penalty.
I guess where is it in the bill? I guess.
Baby steps.
We don't lay out a penalty in the bill right now. It's just a setup. Don't know if that's something we need to do right now. We're just looking at creating definitions and organization and some continuity in the program.
I'm getting a sort of one step at a time.
Okay. Okay.
Representative
Barnes. Thank you, Chair Lady. Thank you, Rep, for bringing this bill. On lines 23 through 31, can you please tell me how long they have to be in recovery? Forgive me, I was a little late. Or how long do they have to be well from their mental health illness? And how long do they have, if they have a relapse, do they certification be on pause, or how does that work? Thank you.
I can answer that. As a person in long-term recovery, and on this day, I went through this certification. You have to be in recovery for 2 years before you are accepted. When you apply, because more and more businesses are accepting this, the competition is up. They do about 20 certifications a year. They train about 20 people at a time. So they have to be 2 years. If they do have a setback, there's a process they go through with a committee, and each case is handled individually on a setback status. But it does take 2 years of recovery before you can be accepted into the program as a
Follow. Thank you. Is their certification paused, on hold during this setback? And is there something that they have to do to gain it back?
Yes, ma'am. There is a pause.
And okay, go ahead.
And they do go back to the certifying group at the Georgia Council, and they meet with them, and they walk through a process, peer-to-peer, to find the integrity back in that recovery journey. It's a complex thing. We find that line between not penalizing somebody for verifying their diagnosis, but also making sure we find that line to protect others. So it is a complex situation if a person has a setbacks, but it's handled peer-to-peer.
Do we need to put that in the bill? No? Okay, thank you.
I think, if it please the committee, we worked directly with legal counsel for DBHDD on this, and I think the agency is satisfied with this language, and if it please the committee, we could always review it in the future.
Thank you for your answer.
Okay.
Thank
I
you.
mean, and we do have people come back, and just like so far you're not seeing any clinics that are opening up and charging that are the kinds you wouldn't want, but if you need to come back and we need to pass something with, if this occurs, then you can come back and ask us to put or approve what the penalties will be.
Yes, ma'am.
And I would think this would be the same way if it's a problem. Thank you. But good questions.
Yes, ma'am.
Okay, are there any other questions from the committee? Okay, do we have anybody that's in the audience that wants to speak on this issue? No? Okay. All right, what is the posture? Okay, because I'm moving, and I, sorry, Teddy, I couldn't see you, I forgot. You want to go ahead and move? Okay, we have a move and a second. Is there any further discussion from the committee? Seeing none, everyone in favor of passing House Bill 657, say aye. Aye. Anyone opposed? No. Okay, the ayes have it.
Thank you, Madam Chair and
You're
Committee.
welcome.
Thank you, committee.
Oh, these chairs are horrible, aren't they?
Okay. All right, let's go next with Representative Thomas, and that is House Bill 668, LC 462001S. What? And you have a helper?
I do.
What's your helper's name?
Her name's Casey Whitworth.
Well, I was talking about the dog.
That I can't answer.
My service dog's name is Dojo.
Jojo? Okay. And certainly I can tell that Jojo was well trained because I've watched them yesterday waiting for us to have a meeting, and they were so well behaved and, just stuck close to their owners, and all of us were running around them, and they were, they knew what they were supposed to do and did it well. So I hope they're not as cold as we are. They at least are wearing fur coats. Okay, you have the floor.
Thank you, Madam Chair. I appreciate that. So this bill, HB 668, and I am going to read the LC number again, LC 462001S. This was a bill that I presented last year in committee. Unfortunately, it was a little too late, and it received, I think, quite a bit of good attention. There was some comments specifically by Chairman Perkle, and that we had incorporated some questions, but again, it was already past crossover day at that point. So I'm happy to be able to bring the bill back. It does address some serious issues that we have, and I'd like to refer all of you to this letter from William D. Gorin. And if you look about the middle of the page, this, I think, is the best way to constitute why this bill is important, and it says this: the statutes currently on the books in Georgia with respect to service animals and service dogs and training are extremely problematic because when they are overlaid with the DOJ final implementing rules on service animals, the current Georgia statutes fall way below the requirements set forth in those regulations. That confusion makes it very difficult for anyone to understand what the law permits with respect to service animals and service animals in training. And this bill is the way for us to address that and come into compliance. And again, it does so. I'll just do a quick rundown of the sections. Section 1, the impact, basically, it increases protections for service animals by updating legal terminology and penalties for harassment. Section 2 clarifies the right of individuals with service dogs to access public transit without additional charges, meaning like additional fees for bringing the dog on. Expands the definition of service dogs to the scope of individuals who may benefit from their assistance. Section 4 broadens the accessibility of public spaces to individuals training service dogs, ensuring equal accommodations. Section 5 strengthens housing rights for individuals with service dogs, prohibiting additional fees. Section 6 deters discrimination and misrepresentation related to the use of service dogs through introducing penalties for saying an animal's a service dog when it's really not, or service animal. Section 7 clarifies the right of way for blind individuals with service dogs, and that's pretty much like the kind of the quick and the easy of it. I will have to tell you that Casey has worked with me and legislative council very diligently, and she's very passionate about the subject. So if Madam Chair, if you don't mind, may I turn this over to Casey to present?
You want to make a statement, or you just want to answer questions too?
I can do both.
Okay, well,
Thank you for allowing us to present this to you again. I've spoken to many of you at the ropes the past few weeks about this legislation and its profound impact on my life and the lives of many across the state of Georgia. Let me share you why this issue is so important to me and why I turned to Representative Thomas on this. I was born with a neurological condition that affects my brain and nerves. I faced many challenges regarding my health and the reality of needing care for the rest of my life. As I prepared for college, a doctor on my team inspired me to get a service dog to assist me. It gave me great independence and allowed me to have some freedoms otherwise I wouldn't have had. In 2019, while I was at an event with my service dog, we were enjoying our time when another dog, labeled as a service dog, approached us and suddenly, unprovokedly attacked my service dog. It bit my dog, causing significant injury, leaving her blind, and ultimately resulting in her medical retirement. When I sought help, I faced the unfortunate reality that Georgia's laws did not protect us in that situation, leaving me unable to pursue charges against the other dog's handler. Fueled by a desire for change, I reached out to Representative Thomas and presented a very rough draft of this legislation before you today. We worked a lot on making sure that there was clarity and making sure Georgia was on the same level or more than the surrounding states it complies with the ADA. A few important points about this bill is that we are introducing service dog fraud laws that is important to bring Georgia in with the majority of the country that has these types of fraud protections. To that point, 31 states have these laws against fraud. And Georgia is the only state in the Southeast that does not have these fraud laws. To allow individuals to, we also introducing legislation within this bill that allows individuals to train their own service dog with specific guidelines to follow. And it ups the penalties for harassment of service animals. Thank you.
all right, well, that brought up a question. I was trying to find it, and I didn't pick up the copy that I marked. Okay, so if another person's dog attacks your dog, what are the penalties? What can they be charged with now? If this were to happen again to your animal, like, okay.
So that would, I believe we wrote it as a misdemeanor.
Is that what it is, Brad? You know where it is in the
Yeah, to my understanding.
I'm going to find it here.
But there is a financial penalty also. Let's see.
Yes, ma'am.
Where are we?
Any person who causes harm. It's
2,000.
What?
213, line 213, is that it?
213, where we are?
That's not it.
Right, well, that is qualified use for service dog, or raises service person.
Line 217.
Yeah.
217.
That was a little early in this.
yeah.
Okay. Okay. Now, that one is considered, that is only if they misrepresent themselves.
Yeah, to clarify, I think what we're discussing is actually line 57.
57.
This is where, so there's distinctions between somebody who claims to be eligible to train a service animal versus an actual service animal that is like hurt. We're talking about being hurt, correct? Like,
Right.
Yeah, which is a felony if it's line 61, 5 years, no more than 5 years and a fine of $10,000. So, and
Okay.
just so you all know, this is one of the bills I have gotten absolutely nobody has come out and spoken against this bill. Matter of fact, most people that have reached out to me have said, hey, listen, this is something we really need to do, and it does get us in alignment with the other states.
So we were, Representative, where are we? 50? Where are you seeing the?
It's a felony.
It's a felony on line 59 if you kill the dog or physical harm that renders the dog unusable for this purpose, and it's a misdemeanor if you misrepresent yourself as certified to use the dog.
Okay.
So there are two different elements of the bill, and both of them I think are good and appropriate to pass in my view.
So again, I had them marked and I just didn't get them because I read it before. So I knew that it was in there because I think that's important that people do know that these dogs are protected.
Dogs
Okay.
are a property, you know, and they're worth a lot more than the $1,500 or whatever the felony standard is. So
That's
if you
okay.
look at it, this dog as a piece of property, which we don't look at our dogs as property, but we, as a matter of law, it's certainly worthy of a felony to damage
Right.
an asset like that.
Well, and I think I think they say it's about $10,000 for every dog that they do train, just the training process.
Madam Chair, that's the lowest amount. These dogs go up into price closer to 60.
Okay? How does anyone ever afford a $60,000?
And most people who have a need for these animals are on disability and or they're applying for disability, and we have a limited budget each month. So those are astronomical numbers, and they're not going down, they're going up.
I have bought service dogs for wards that I manage through my law practice, and they're a very valuable asset, certainly worthy of a felony.
And I know that we have a really, I think, and I hope y'all agree, great training program here called Canine, is it Canine Assistance?
There are ongoing training programs that are required to be used if you're in proper order with a service dog.
Okay, I probably need to find the name, but if you haven't been to one of their graduations where they have had the dog trained, and then whoever's going to get the dog has to come and train with the dog for a couple of 3 weeks. When you go to graduation and you see them getting their dog and what they can do together, you want to go out and, you know, sponsor a dog for anybody that needs it, because it's such a bonding and such a help for what the dogs can do. Okay, questions, who have I got? Osteen? Representative Osteen.
Thank you, Madam Chair. I'm learning, so that's why I'm asking questions. I think it's a great bill. It's wonderful. You did answer the first question that I had, is how much do these service dogs cost? So up to $60,000? Is there like a program? No. I'm with the chair. I don't understand how just about anybody can afford this. It's astronomical. So, two questions. One is, are there specific conditions that qualify you for a service dog?
And yes, ma'am. In the federal law.
In federal law.
In the
okay.
federal, the ADA identifies those.
Okay. And so, you know, some people get them like for a companion or for anxiety or
Emotional support.
emotional support dog.
The-
That's my question. Okay.
We actually, at the beginning of it, when we define what the service, we
Yes.
specify that emotional support does not qualify.
Okay. Please, Brad.
I told her I'm 100% on board with this, but I don't do cuddle animals.
Right.
That's not okay
Right.
with me. You're not bringing your emotional support iguana on an airplane.
Right.
We're not good with that.
Thank
So
you.
This is
I-
very specific.
I'm
very,
with you.
Very tightly tailored. Yeah.
And the last thing is the service animal, the little like vest that they wear. Can you pick those up anywhere, or is there some kind of like certification that's on that dog that lets me know that this person is not, they hadn't just picked it up at the pet shop? Does that make sense?
Yes, ma'am. So you can get a service dog vest off of Amazon, and that's where the service dog fraud comes in. And the federal law states that a service dog does not have to wear any identifying markers. What tells you what a service dog is where the federal law allows you two inquiries. Is that a service dog, and what task has it been trained to migrate? And if a service dog handler can't answer that with a specific job the dog does, then that's federally all you can ask. Now, if they answer the dog is for comfort or emotional support, that dog does not qualify on a federal level of being a service animal because it's not trained to do anything. I'm happy to disclose, my dog is trained to alert me to a neurological condition. She senses that chemical change and will let me know so I can take medication so I can potentially avoid a hospital stay.
Sure.
And so federally she is qualified to be a service animal.
Thank you for educating me. I appreciate that so much.
And Representative Osteen, if you go to line 111 to 113, that's specifically where that's explicitly written in the code that we're trying to, or the bill.
I was going to ask a question.
111, yeah, 111.
Okay.
Yeah.
Okay. Thank you so much.
Okay. So an individual is able to train these dogs in the way that they need them trained?
Well,
So
she doesn't train.
So the federal law allows an individual who has a disability to train their own service dog. And what we're trying to do with this legislation is give a blueprint of what the guidelines are. We specifically say, I want to say 4 or 5 specific things that these dogs in training have to meet in order to be in public areas that aren't pet friendly, because the federal law does not give that blueprint, but it does allow us to train our own dogs. I trained Dojo myself as an owner trainer. We weren't allowed to do any public access, and that is considered going into non-pet friendly areas until she learned her first task. And once she does that, once she learned her first task, she then met the federal definition of a service animal, because the state of Georgia doesn't allow service dogs in training in public, non-pet friendly areas, and we're trying to open that door to allow service dogs in training into non-pet friendly areas so they can be better prepared for when they do meet those incidents. Like I couldn't train her how to act in a busy restaurant with kids running around, or even the Capitol and how busy the ropes are, because I wasn't allowed in these public areas until she learned her first task. And it makes it very hard on the animals and us as handlers to do that.
I see.
And if you look at line 98, it explains owner training,
Yes, ma'am.
okay?
And I'd also like to mention, again, we're talking about dogs that cost $60,000. I mean, we got to give people an opportunity to try something else and put it. I think it was Representative Richardson. I think that's a legitimate question. It was something that I was concerned about too. But again, when we're dealing with this absolutely astronomical number for people that really, we got to do something here. And I think this is the best approach. Again, the ADA does allow for this, and now we've set some methodology in place. So, a great question.
Madam Chairman, thank you for the bill. I'm getting educated as well. But back to the line 57, 58, and 59, we talked about the person that will offend the dog, but it also says when he or she knows or should know the dog is a service dog. You may have answered that question with the vest and all, but how would a person know that a dog is a service dog?
I've actually ran into this, and normally when I have someone approaching my service dog in the intent to do something to her, harm, say hi, be nice, whatever, I always state, hey, I'm sorry, she's a service animal, and I verbally warn them, sometimes multiple times, and they still do the action, or they say, I'm sorry, pet her for me or something. And I don't want to speak for every service dog handler in the state of Georgia. However, I'm going to. Mass majority of us will always say, hey, this is a service animal, please do not. Or, hey, this is a service dog, can you remove your dog away from us? We verbally warn, and most of us have stickers, patches on our dogs labeling them because it makes it easier on us.
And also, Representative Howard, I'd also say that there has to be a little bit of thought put in for maybe the person that didn't know that this was a service animal, and have some consideration in this, because this is a pretty hefty
You're right.
penalty if you're found guilty of it. So we tried to find, that was our way to try and strike a balance and find some moderation in this. So, but thank you.
I mean, I think one of the worst things is, there's somebody else here with another dog. I love dogs. So the first thing I want to do as I was talking to the dog, and it got up like it was going to come over for me to pet it, and she gently took hold of it, and there he is over there, and told him very quietly, told him to lay back down, and I walked off and said, excuse me, I shouldn't have spoken to him, in a very friendly way. I mean, it was like almost, come on puppy, I need to pet you. I mean, I really didn't mean to do it on purpose. But it was you get people, and that does happen, and you just tell them, and that's the kind of thing that you need to do. But there are some people that will insist on petting service dog. Was he? Okay, we'll take that in his testimony, not to do that. Okay, Representative Hilton.
Madam Chair, at the appropriate time, I'd like to make a motion.
We have one more person, and Representative Sharper.
Thank you so much, Chairman Cooper. I was just wondering, maybe it's in here somewhere, but do we have a Georgia registry for service dogs?
No, not that I know of.
No. So the federal law it's question number 17 under the ADA FAQ of this legislation for them that there's no legal registration for service animals. Now, it does state that you can voluntarily, like I know my county has a dog registry for the county. I can voluntarily say, hey, this is a service dog, but I do not have to disclose that because federal law says I don't have to.
Okay. Well, just a follow-up that we should consider something like that in the state of Georgia, because when it comes down to, when you have a problem, then we need to it'll be a way to prove it and make sure it's done. But that's just my thought, maybe.
And I don't mean to speak out of turn here, but I think what Casey's trying to say is we're preempted by federal law to be able to do exactly what it is that you're saying.
Okay.
So.
Oh, no. Oh, wait. I just don't know how to.
There's dog registries. No, I know you don't have them.
Okay.
But since we're trying to be learning about this, is there anything you would like to add about how we deal or?
No, I think this is a good bill. We're making some progress, and I think all of us are becoming more aware of the difference between a real service dog and a pet that helps me feel better.
Right.
So this is a bill I'm very happy to support. The cost of these animals is extensive. I have not paid $60,000 when I've purchased them, but I've paid $3,000 to $6,000, which is kind of probably the entry level.
That's still a lot.
Well, I certainly was in favor of the bill. And I had read it last year, and they have changed it to make it tighter and I think cover more areas that it needed to cover that we talked about today.
Oh, that's interesting.
And the fact that it gives people with disability more mobility and better able to, be part of our environment and our communities and not be isolated, I think is a wonderful thing. And so at this point, who wanted to see me? Representative Reeves.
Yes, Madam Chair, and I'll be real quick. Representative Thomas, I just want to thank you for bringing this bill. You brought it last year, and we supported it overwhelmingly because it's a great bill. Representative Sharper does a great recommendation about the registry. I don't know if it's going to solve the notice aspect from a legal perspective, because you can't say a registry is giving people notice that, now you're holding all Georgians to knowing who's on the register. So that's why the notification on the dog itself and the voice of the owner is the knowingly or should have known portion of that. So I move we close debate and recognize Brother Hilton for that motion, Madam Chair.
All right. At this time, Representative Hilton, you ready?
Chairman Thomas, you and your emotional support iguana, I want to make a motion to do pass.
Mine's a ferret.
Well,
I'm going to bring mine to committee, my emotional support iguana.
You laugh about the iguana, But we also passed out at this meeting to add pets to our, wasn't our committee, it was out of Judiciary. Thank you, Representative Olive, for helping with that. And I understand there was some discussion about that bill, maybe behind the scenes with some people higher up in there, is that if an iguana would count as a family pet. And, you know, and apparently, no, if a family is a family, that was a family pet, and the children loved it, and that was a pet, it would qualify. Not as a service iguana, but as a family pet. Pardon me, sorry. Don't give me a hard, the next bill is mine, so don't give me a hard time. And I'm going to turn this over. Okay.
Motion second.
Oh, we didn't know. All right, we've got a do vote and a second? Okay, and we go. Everybody in the favor of the passage of, which number bill is it? House Bill, I got my things out of place. House Bill 668, say aye. The substitute to House Bill 668, say aye. Aye. Anyone opposed? No. Okay, the ayes have it.
Thank you all very much, and we're very excited to move this one forward. Appreciate your support.
Good luck. Okay. You want to switch seats or just, you good? Can you do it from here?
Yes, ma'am.
Okay, well, here, I'll go sit in the seats and ask the people to come up.
Okay.
Okay, if it's all right, Mr. Chairman, I would like to have some people join me at the podium.
Yes, ma'am. Are they signed up, or were you just bringing them up and introducing them at the time?
Are they signed up, Chair?
Madam
Chair,
Are they signed up, or you just introducing them and they are coming up?
I don't use a sign
Okay.
seat.
All right. All right. Thank you.
But if you want me to get one.
No, ma'am,
I will
that's
do it.
great.
I'm just asking them to, no, they're here with me. Okay. Pardon? Yeah, right. Okay, got that. Okay, members of the committee, I bring to you House Bill 717. This was brought to me by the Board of...
LC 339812?
You going to give me a hard time?
No, ma'am, I am not.
See if I ever turn this over to you again. It is LC 339812.
Thank you very much.
Woo! Okay, that's all right. Okay, and how long have you been here? Have you had a first bill yet?
Yes, ma'am. Yes, ma'am,
well,
I have. Thank you.
Oh, I missed that opportunity to give you a hard time. Okay. This was brought to me by the Board of Medicine. And I will say that the doctor that had worked with the chairman of the board was here yesterday. He waited 2 hours, and when we found out we were going to be going forever, he had to go, and he's in surgery today. So I have with me the executive director of the board and legal counsel, and they are here to help me. How many of you were here when we had to regulate the pain clinics? Nobody? They were starting up all over our state. They were run by people that really were on the fringe. We had citizens becoming addicted from what they were giving out. And we had the same thing with the methadone clinics. So we have another problem. Right now, that problem is the ketamine clinics. There are 15 of them in the metro area already. I put a thing in your packs for you to read about Matthew Perry, but they're not just going with the celebrities. They are hurting citizens of the state of Georgia, and it's growing. Ketamine is a very unusual drug. It is very strong, and they are administering it not by mouth but by IV. And that's directly, of course, for those that might not know, directly into your bloodstream. We do not know if the people that are doing the intravenous procedure, if they're qualified to do it. That is a nursing procedure or a medical procedure. And when you inject something directly into the bloodstream, it works very quickly. It is a bigger high, I guess, to the patient, but it's also has a bigger effect on the body. And I will read, and then I'll turn it over for questions, and y'all can ask. what this says on the back of this says, what are the risks of ketamine? Ketamine can also be used at parties and clubs because of its ability to make a user feel like they are having an out-of-body experience or a hallucination for some time. And overdosing of the drug, and here's the problem that we are trying to prevent, that can result in a variety of symptoms, including amnesia, seizures, or also a person can fall unconscious or experience dangerously slow breathing, which can lead to death. And this comes from the Drug Enforcement Administration. So, science has moved to where they are saving and letting the mental health people use these drugs, the psychiatrists. But as they use them, and there are more coming, we need to be able to have parameters, especially as these clinics start up. So with that, do y'all want to make any opening statements? Or would you just rather answer questions? How would you like to do it?
We can make a brief opening if you'd like.
Give them your name.
My name is Kimberly M. I am the Deputy Executive Director and Legal Officer for the Georgia Composite Medical Board. So the board's purpose behind this legislation is to establish parameters to promote safe and effective prescribing, administration, and post-treatment monitoring of psychedelic-assisted treatments and therapies. So right now, as Madam Chairwoman stated, we have ketamine clinics in this state. That is currently the only psychedelic-assisted therapy that's FDA legal right now. So the ketamine is currently FDA approved as a general anesthetic. So they're using it off-label is what it's called. So it's not FDA approved for the treatment of these psychiatric conditions. They're using it off-label. So there's no actual guidelines or parameters around the usage of this drug. They're what it's known as right now is the Wild West. So we have these ketamine clinics. We don't know what their protocols are. We don't know what they're dosing these patients with. We don't know how they're monitoring the patients after they're dosed, because these patients are in essentially a hallucinogenic state. So they are very susceptible.
Can I ask a question right here?
Of
so
course.
are they doing other procedures in those, or is that
We don't know.
is that
We don't know.
you don't have, okay. Thank you.
Right now, the ketamine clinics are unregulated. So the only thing, they have a business license in the counties that they're licensed in. But other than that, I know that there are articles out there that state that, well, the medical doctors that are prescribing it are licensed and the nurses are licensed. But the problem is that we don't know who's actually working in these clinics. So we don't have any way to regulate that at this time. And, when opioids became an issue, we regulated the doctors and the nurses then too, but the opioids were still an issue.
All right.
Okay.
Jason?
Oh.
We have several questions. So, who is for? Let's see. Hilton. Representative Hilton. Are you on?
Hello. There we go.
Go.
Thank you, Madam Chair, Mr. Chair. Sorry. Two quick questions. One, and it may be defined elsewhere in the code. Do we define psychedelic? And I just want to make sure that we're not. It seems to be that you're going after ketamine. I'm guessing there are other psychedelic drugs that are used for good purposes, maybe treating veterans or whatnot. Do we have a definition?
So we defined psychedelic assisted treatment and therapy in lines 17 through 20. So means any treatment or therapy using psychedelic, dissociative, or other related substances that have the potential to produce hallucinations or rapidly induce suggestibility in the user or profound changes in perceptions of reality or the self. So the reason that the board went with a broad definition is because there are currently clinical trials in regards to drugs such as MDMA, which y'all might know on the street as Molly or ecstasy. There's also clinical trials regarding psilocybin, which on the street is called magic mushrooms. And there's also clinical trials for LSD, known as acid. So there are clinical trials regarding all of these drugs into these mental disorders that are currently going through clinical trials.
Okay. Would that disrupt those trials, or?
No, this bill, we actually built that in. So on line
And I guess that leads to my, line 90.
93 to 95.
Yep.
Nothing in this code section shall be construed to prohibit the use of psychedelic-assisted treatment or therapy in a hospital setting, because I know like Emory has a program right now for these drugs. They are doing research.
Oh, wow.
As well as in a clinical trial approved by the FDA. So any clinical trials approved by the FDA, this bill would not touch those trials.
And this may be a semantics question or a question. I don't know if we have ledge counsel. There we go. I guess ledge counsel, my question would be on prohibit. Nothing is, I was taking notes here. Sorry, 93. Nothing shall be construed to prohibit the use of, if we change it, nothing shall be construed to apply to the use of, does that matter if we change it?
This is standard language,
Okay.
so I would be in favor of
Keeping,
it.
okay,
Yeah, and
okay.
also, Rep, I did do a search, and there isn't anything in the code with respect to psychedelic.
Representative Hilton, what are you getting at? What do you want to, what are you afraid of? That will happen.
Well, I was interested that there's clinical trials going on. I wanted to make sure that we're not disrupting those. Yeah. So
Yeah,
it sounds
we-
like prohibit is.
Yeah, we specifically added that language in to ensure that we don't inhibit those clinical trials.
If I might, I think that we've already had a bill pass out of the House from one of our pharmacists. There is a drug now that they are looking at. It was the one where that they can go back sort of on an emergency basis and change how a drug is classified from like a 1. They are testing a 1. Schedule 1, which means you cannot use it, basically, that it's very dangerous, and it may go to a 2. If it goes to a 2 and it comes from mushrooms, if I'm misunderstanding, and it is extremely hallucinogenic and dangerous. And so, that would be one of the things that they would be looking for if a clinic, which if that's allowed as a Schedule 2, then they would, I'm sure, be some of the first ones to try to use it, and one of the reasons why they need these parameters. And it's in, the FDA is talking about it right now.
Perfect.
And these other drugs that come from different things that are really highly, highly dangerous if not given in the right way, and they do not have somebody to be there to make sure that they don't leave the clinic if they are still in an altered state and go driving on the highways, or if they're not breathing correctly and are going to stop breathing, or if it's, what happens if they throw up and, they ingest and if there's not 911 called and they stop breathing. There's just a lot of problems that can happen if these clinics do not have the proper people trained to know what to do, and Representative Val can tell you a lot more about what happens if they quit breathing and don't breathe right.
You're up,
Great.
Representative.
Thank you so much for bringing this bill. I can't believe that ketamine clinics are not regulated. That to me is ludicrous. So that's crazy. We need to pass this, so let's just say that up front. Ketamine is a Schedule 3 narcotic. So that's shocking to me. And I will say that as an anesthesia provider, that when we give ketamine, as we often will do as sort of like a pain adjunct in the OR or to do procedures, that we actually tell our recovery room nurses this patient got ketamine because they need to be watched for longer, right? Because it works differently than other drugs, and there are side effects from it that we need to keep an eye on. So the fact that we aren't watching these patients in the same way, we will sometimes use ketamine, just to give an example, in trauma patients to induce general anesthesia, meaning giving ketamine, even just by itself, is enough to start surgery, right? So this bill is extremely important. Just to your question about regulated substances and FDA-approved research, we do research on controlled substances all the time, right? And the difference between a Schedule 1, Schedule 2, and Schedule 3 is a Schedule 1 narcotic actually is determined to have no therapeutic benefit at all. Right, so we don't use them in medicine, but Schedule 2 is what we're more familiar with, like, oxycodone, opioids, that type of thing. This is Schedule 3, so it's one step below that the risk of addiction is moderate, but it's certainly not nothing. So I strongly support this bill. I can't believe we even need to bring it, but we have a chance to do some good today.
So.
Representative Howe, sorry, let me ask a question.
Yes, yes, ma'am.
Isn't ketamine from a horse tranquilizer, or wasn't it used to use to tranquilize horses?
So ketamine is what we call a dissociative anesthetic, and what people are probably most familiar with it is in veterinary medicine, is that we will often use it in vets' offices to do surgery or do stitches in your dog or what have you, and that was often a cause of crime in veterinary clinics, as people would break into vet clinics. It's still ketamine for recreational use, but we certainly use it in humans frequently, particularly now in our push to mitigate risk of opioid exposure and dependence and addiction, is that we use it as a pain adjunct in specific because it works differently than opioids, but it does have some good anti-pain effects.
Representative Hilton.
Madam Chair, I was going to sneak out to go to education, but I didn't want my absence to be a signal that I don't support this bill, so I'm going to go ahead and make a motion. Do pass. I think you have some other questions. You got to go. Okay. I don't want you to lose. Okay. I don't want you to lose quorum. So motion do pass. Second.
All right, we've got a motion and a second. I'm gonna go ahead and call. Call for the vote.
Okay.
All in favor?
Aye.
All opposed? All right.
Can I ask a follow-up real quick?
Yeah, absolutely.
I just want to say thank you to state employees for what you guys do. 'Cause this is the kind of stuff we need to hear, right? But my question was going to be trying to understand this, and when I thought I had a question that made sense, then I listened to Representative Hilton, Representative Ah, and Chairwoman, and now it's like my question may sound crazy. But can we construct a bill somehow or a law that when drugs of this nature are introduced to our state, it automatically triggers a review by us or someone to see if this should be,
Or composite medical board.
or the board or somebody to see if this should be regulated in some kind of way. Like, it shouldn't be this far down the road before we're coming in saying, hey, we need to regulate this. At some point, it was introduced to the market. And I know I'm not probably saying it properly, but at some point it was introduced, and we should have been discussing it then because we understood the concept of the medicine and the impact and the dangers at that time, right?
And that is a great concept, and one that I'm sure that the board would love to take a dive into. For this, ketamine got approved originally in 1970 as a general anesthetic.
I wasn't even born.
Me either.
Okay.
Right here.
I'm sorry, Madam Chair. I'm sorry.
So I definitely believe that would be something that the board would be interested in.
Okay.
Because, I mean, just like what you're saying now with not even the drugs, but why are we so far out from this already? Because, I mean, the medical board has the same fight with Medi-Spas.
Yeah. Yeah. Madam Chair, Mr. Chair, I would like for us to pursue that as a committee. How can we be proactive? Because we don't need to let Georgia get down this far down the road with these things. So we can work something out. We have the brains to do that.
So I just have a statement on that.
Yes, sir.
So I'm the new executive director. We kind of come on at the same time, about a year. So we're trying to figure a lot of that stuff out. And we're reaching out to the DEA to build that relationship so that we can have that talk when it happens, so that we're staying ahead of things instead of catching up. So
You'll have our
Proactive instead
support.
of reactive.
You have my support with that. Yeah.
So let me ask a question too. So
Thanks, Danny.
are these people, like, you just walk in and say, I want some ketamine? Or do you have to have a physician's order? How does that, I don't understand.
So we're really trying to figure that out right now. So ketamine as a Schedule 3 does require a prescription. So it is controlled by a DEA registration. So somebody with a DEA registration has to issue the prescription. We don't know what those prescriptions look like right now because really this is off-label. So it's not being prescribed as a general anesthetic where you're looking to put somebody under. You're looking to induce a hallucinogenic state. And that's kind of, and they're playing with it, all right, let's give you a little more, let's give you a little more, let's give you a little more to see how we can get you into that state.
And what conditions would
So right now they're using it primarily for treatment-resistant depression, anxiety, PTSD, chronic pain, and a couple other disorders.
Chronic pain?
Chronic pain, because as Representative stated, that it is an alternate to an opioid.
Right.
So they are using it to also treat pain.
This is jaw-dropping to me that we do not have some very serious regulations around people being able to, Georgians being able to go in and get this. I just cannot believe this. I'm so grateful you brought this. This is incredible. Incredible.
Real quick, since we've already had a vote, I'm going to give
Yeah, we
you,
can just go
Representative Howard, you had a comment, I think.
Yeah, just comment. And I guess I was wondering, and I was waiting to hear Dr. Hour's comments before I said it. But why isn't there some federal regulations that will cover? This is not just a Georgia problem. It seems like it's
It is not.
a
And
state problem.
the thing is when prescribers use prescriptions off-label, there's no regulation for it.
I mean, you don't write prescriptions for something.
And we're creating an inspections unit
To
to this. We're requesting that in our budget this year to get 4 additional inspectors. Because we don't have an inspections unit as of now, but we're hoping to create one to be able to go out and alleviate some of this.
Well, can I say, Representative Howard, I mean, just think how anything moves so slowly in D.C. about regulations are changing, and it's off-label. That's not what they approved it for, and people are using it for what they shouldn't be using it for, so it's just a slow process for them to.
Representative Taylor, I think you had a comment also.
Yeah, my thought process of this whole issue is, why can't we change the word of clinic where they're being utilized and make them come under like an outpatient surgery and reclassify where you can even dispense it at instead of having it as an office visit? Have a new classification if we have to, so they can't just do it in an office setting. Is that, to me, that would be a way to fix it, and you'll know who they are, they can be inspected, and they would be treated a lot more closely with what they're doing.
And they have skilled nursing.
Right, you would know you would have to have it, and it would be more highly regulated for all of this, particularly if we're going to have more coming down the road. I would like to see another classification. It's more like an operation or surgery if you're going to do this caliber of an anesthetic. And look at, I would say look at that in another manner. That would be my suggestion.
Have you got an answer to that?
We do not have an answer to that. I guess our only answer to that would be that those type of centers are actually regulated by the Department of Community Health and not the Composite Medical
Well,
Board.
we can have a nice long talk with them, because I think it does need to be, right now we need to do this, I get that, but in the long run, to fix this, we need more oversight of where they're being dispensed and knowing where they're at. So let's come up with a category of, this is where you can do it at this type of clinic, and they're inspected more, follow it, they have to submit the information, and that's the way for us to gather it. Thank you, that's my thought.
Thank you, Representative Taylor. Representative Sharper.
Thank you,
have
Vice
a
Chair.
comment?
I'll be very brief here, if I can. But just like most of the medicine has been out a long time, and the other states, they're using, ketamine, different places it has good reasons to be used in hospital settings, in some states pre-hospital settings. So when you look at that, that's just like saying to control any other drug. But because you have the clinics that are saying, oh, wow, okay, we're getting more people, and then next thing you know, somebody in the community say, I went to that clinic, because they could set up as a regular clinic to be seen, do the regular, but once the community gets to know I'm going to Dr. Johnson, he's giving you that stuff, and the other one, next thing you know, everybody's coming there, and then the clinic saying, okay, we got a lot of people coming here for that, but I'm wondering if the pharmacy somehow, I know it may be hard, but the pharmacy or anybody can get a whiff of what's going on at a particular, when you guys do your investigations, should be a way to mark whatever's going, even activity of a lot of people coming to that particular clinic for that particular thing, because a lot of these clinics are legitimate clinics that can see regular patients, but they're just using that particular drug once the word get out that that's where you go to get it. So that's what's happening.
Okay. Thank y'all, everybody. Good conversation, good input, and I think there's some more stuff that we need to be looking into down the road. So thank you very much.
Thank you.
Thank you. Thank you very much.
I don't have.
Where are they buying?
I don't have that authority.
Are we adjourned, Madam Chair?
Yes.
Are you adjourned?
We are adjourned. Thank y'all, everyone.